Thanks for tuning in to American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre.
Happy to be here.
And world-renowned orthopedic surgeon Dr. Alfred Bonatti of the esteemed Bonatti Spine Institute.
Hello.
After a 6-year struggle with Parkinson's disease, our next guest became the first patient ever to receive a newly approved system for treatment. His name is John Alexander, and he's here to tell us about the Infinity Deep Brain Stimulation System. Thank you for joining us on the program, John.
Thank you for having me.
Now, John, tell us about your initial diagnosis, what was going through your head after such a diagnosis, and what the next 6 years entailed for you.
Well, I came to realize that actually today is the 7th anniversary of my diagnosis with Parkinson's on January 6th of 2010. Naturally, it was rather startling at first and not something I had expected because no one else in the family did have that condition. But I did some what I call extensive scientific research at that point, meaning I read Michael J. Fox's book, and I came away with two conclusions. One is that you don't die from Parkinson's, you die with it, meaning it's not like an aggressive form of cancer. It's something that is going to be around for a while. So I had to make a choice of how would I deal with that. And the second thing was that it's a boutique disease, meaning it's different for every person. So no one that might have had Parkinson's, or particularly say the celebrity people that I had seen, my progression would not necessarily be the same as theirs. I adapted fairly quickly, I guess I should say. I think I was fortunate to meet some people fairly early on who were very inspirational and had a positive outlook, and that helped me a great deal.
And John, how bad did your symptoms become to where you decided to essentially be a guinea pig for a new treatment? How bad was your Parkinson's symptoms?
Well, it was sort of a steady progression. In the beginning, the condition was fairly slight. I had not even noticed some of the telltale symptoms, like a bit of a tremor in my left hand. One of my regular doctor visits, my doctor had noticed it, and that progressed to getting a brain scan and having a meeting with a neurologist who diagnosed it. But I took medication for a while, and that was fine, and the symptoms were fairly well contained for a good while. Can
you tell us the difference, though? Because I'm reading here that there's a difference between Parkinson's disease and essential tremor. What is the difference for people that are unaware?
Right. Parkinson's disease is a combination of both motor symptoms and non-motor symptoms, and that's where they can be different for each individual. Tremor is one of the predominant symptoms, though some people with Parkinson's do not even have tremor, but it could also be rigidity, which could be a stiffness and an effect on your fine motor skills. For example, in my case, that would be a challenge in taking the keys out of my pocket or putting a key in the front door. Also could be something like micrographia, which is a fancy term for illegible handwriting. Your handwriting looks like your grandmother's handwriting.
Got it.
Even though you might be much younger. Or dystonia, which is a curling of, say, your toes or some other area involuntarily. Some other people with Parkinson's can have digestive problems. They can have cognitive issues, memory issues, balance issues, freezing, which is the inability to move forward. So there's a lot of different things that can happen with Parkinson's. Essential tremor is more generally related to specifically a tremor, and while it's similar, it is different, and yet there are some procedures that overlap, I guess I should say, that they can work for both.
Well, John, let's get into the actual treatment because we only have a couple minutes left. Tell us how you decided to become essentially the guinea pig for a brand new treatment called DBS.
Right. Well, the choice of what system to use for a deep brain stimulation surgery is generally up to the neurosurgeon. However, my neurosurgeon, Dr. Kelly Foote at the University of Florida, gave me the courtesy of a phone call a few days before my surgery, which had been scheduled for October 5th. And he was explaining that up to this point, for the last, say, 20 years, the only DBS devices that were available were from a company called Medtronic. But another company had just gained approval. St. Jude Medical had gained approval for its Infinity deep brain stimulation system late in September. And they had chosen October 5th as a date to implant the first device, and there were 3 surgeries that were scheduled for that date, one of which was mine. And he said that I, for a number of reasons, would be probably the best candidate amongst the 3. And then he went on to share with me the differences and the fact that St. Jude Medical has been trying to get their system approved. They've had the opportunity to also have advances in their system. Okay. For example, there's 8 what are called leads, which is the end of the wire that sends out the electrical signals to areas in the brain, whereas the other product only had 4. And then as far as programming, which is controlling exactly what impulses go to those various leads. The St. Jude Medical product has the programmer, who's part of the medical team, has an iPad to use to program it. And then as the patient, I actually have an iTouch to use to select between different programs.
Now, when I was reading, it said that you can bypass certain areas that would cause problems.
And only affect the ones
The idea of having, say, 8 instead of 4 leads is that much more opportunity to have positive benefits and avoid negative benefits. So, for example, one symptom of Parkinson's that people know about is called dyskinesia, which is sort of an involuntary flailing of the arms and such, or kind of rolling of the head, that kind of thing. If they were to send power into the wrong area, it could actually cause that negative side effect to occur. So here they're able to work around that and avoid that type of issue.
Unbelievable. What happens if you don't have access to the device?
Well, it's not really that critical. Everything really is internal.
Okay.
There's a wire that's installed or implanted into the brain, and then that runs down your neck to what's generally called the battery, but I think the official term is a neurostimulation generator. So that's the device, and probably really a little computer that's very much like a heart pacemaker. And so that part is installed in the chest, and that's working all the time. And that has a battery that does not need to be recharged. It's good for from 3 to 5 years, depending on when they feel they need to replace it. But the device that I have for controlling, if I'm away from that device, that has no impact on my receiving the steady signals that I need to control my symptoms.
And we're almost out of time. Just quickly, how are you doing after the surgery?
Doing great. I go back to visit my doctors once a month for the first 6 months.
Sure.
And they alter the program slightly to optimize the improvement of my symptoms. And so far that's worked out extremely well. But I currently have 6 different settings that I can choose, and they can program up to 16 different settings, which is a remarkable amount of flexibility.
Interesting. Well, we'll check back in maybe a few months and see how you're progressing, John.
Fantastic. I appreciate it.
Thank you so much. John Alexander, he is the first person to try the Infinity Deep Brain Stimulation System.
For Parkinson's.
Thank you so much
Thanks, John.
for joining us.
Thank you.
Good stuff.
Amazing strides in technology. Make sure you stay tuned, because coming up after the break, our Back to Life segment.